Friends, welcome to this session of Biochemistry. Today, I bring to you one of the hot favorite question of the examiners, a clinical scenario landing up in almost every paper of your exam, whether it is the NEET PG, whether it is the INCT, or it is the SMG. This is one clinical scenario we are very likely to encounter. So, let me read the sample question and then I'll discuss this topic with you. Okay, so a 1 month old child presents with poor oral intake, lethargy, vomiting. On examination, hepatomegaly and jaundice are seen. There is also a presence of a cataract, the picture is shown here. The urine test shows positive and negative result for glucose. Which following enzymes is likely to be deficient: deoxyribonucleic kinase, galactose 1-phosphate urinyl lactose 1,6 bisphosphatase, and glucose 6-phosphate dehydrogenase. Now, this is one of the very important, commonly repeated question. And in this question, a large number of features of this disease are already mentioned. So let me quickly go through the features. Before we go there, please note now this is a case of galactosemia, and the correct answer would be galactose 1-phosphate uridyl transferase. If you look at the metabolism of galactose, galactose is first converted to galactose 1-phosphate by the enzyme galactokinase. Galactose and phosphate converted to UDP galactose by the uridyl transferase, and UDP galactose then converted to UDP glucose by the epimerase. UDP glucose can then go towards the glycogen metabolism. In addition to that, the UDP galactose can be used for a lot of intermediates like the synthesis of lactose, for the synthesis of glucose, for synthesis of glycolipids, for synthesis of the glycoproteins. So in a lot of places, this UDP galactose can also be used as the precursor. Now, most commonly, the block in galactosemia is the second enzyme, that is galactose phosphate uridyl transferase. This is the classical galactosemia. But please note the deficiency may also be at enzyme 1 and enzyme 3. Galactokinase deficiency and the epimerase, also known as galactosemia, although they are the milder versions. Epimerase deficiency is very rare. The typical galactosemia is the galactokinase deficiency. It is a milder disease. The severity is less. The cataract appears by the age of 1 year. So these additional mild features are there. The cataract that you see is described as oil drop cataract. It looks like a drop of oil is sitting in between the cataract. So it is called oil drop cataract. So you have the brain damage, cataract, jaundice, enlarged liver, and kidney damage. These children are very predisposed to developing sepsis on infection, very severe response to infection, leading to the development of fulminant sepsis. So as we saw in the question, what will be the findings described in the question to help you identify the correct answer? Number one, typically, time of presentation would be as early as first week of life. It may be 15 days, 25 days, 1 month. And these symptoms will start appearing if you take the history within the first week of life. With the parents are alive, they would bring the child immediately. Some parents might want to wait and watch. So, in 15 days, 25 days, 1 month, this child will present to you. Why this first week of life is important, you have to remember that some feature can be there in the hereditary fructose tolerance. But in that case, the presentation will be when you start the weaning, 7 months, 8 months, 9 months, because the fructose is not present in the breast milk. Okay, so this time of presentation is very important. The system affected in terms of presentation is the neurological system. So signs and symptoms relate to the neurological symptom, and common features would be vomiting, poor feeding, lethargy, decreased responsiveness. These would be the features which should arouse the suspicion of the examining clinician. On biochemical examination of the urine, please note here we are doing the biochemical examination of the urine, you will find that Benedict test is positive. For glucose, that is the glucose oxidase test will be negative. Benedict test is the non-substitutive for all reducing substances, including sugars, amino acids, the vitamin C, etc. All of these will give the positive Benedict test, but the test for glucose will be negative. The enzyme deficiency is the galactose 1-phosphatidyltransferase transferase, most common. The enzyme can be written in the question by different names. For example, it can be written as GALT. GALT stands for galactose 1-phosphatidyltransferase transferase or galactose 1-phosphate transferase. Dalpit is a short form for galactose transferase, and sometimes it is simply known as the uridyl transferase. These are different names by which the enzyme is known. Okay. These are important points. Number one, the risk of development of sepsis. And number two, the attack may not be present at birth. In the milder cases, it may take up to 1 year to develop. So, the absence of ultra cataract when you examine the child does not rule out galactosemia. Presence of the older cataract is more or less the confirmatory kind of presence of the galactosemia, and that too classical type. So I hope with this you are able to confidently answer the question on galactosemia. This is a very, very uh, high likelihood question to be in the exam. So make sure you look at it before you. Best of luck. Thank you very much.